let's talk about canine guidance. And I'm obsessed about canine guidance, or as they call it, mutually protected occlusion. And I want to share with you my thoughts on that. In the most laid back, I want to explain to you what is a canine guidance and why it's so important. You'll be amazed how many times I ask many dentists, especially young graduates, why canine guidance are important, and they can't really explain it because no one understands it that easily. And I want to share my thoughts with you. First, for credibility, my name is Khaled. I have been a dentist for 20 years. I own my dental practice, Lakeside Dental Spa in Hervey Bay in Queensland, and I took it from 1 chair to 10 chairs, from 3 staff members to 40 staff members over the course of 14 years. Whenever I ask a dentist about why canine guidance are important, they give me the answer, yeah, because canines protect the back teeth when patients are grinding or moving their jaw right and left. It's like, okay, the next ask why, again, is why do they protect the back teeth? No one seems to know the answer. I'm not sure why. And I'll be honest, when I track back, I never understood it as well. It was explained to me the same way, like, oh, they just protect the back teeth and that's it. Only when I understood why they are important, I start getting an obsession with canine guidance. Whenever I'm doing Invisalign or orthodontic treatments, or even doing a filling on a 1.4 or 1.5, I want to make sure when the patient is doing eccentric movement that canines are the only teeth touching and the back teeth are not touching. If I'm restoring missing teeth on the back teeth, a single implant on 1.6, I want to make sure on lateral excursion only the canines are touching. If I'm doing a full arch rehab or all on 4, I want to make sure there's some sort of canine guidance whenever possible. So the only time I understood what is the importance and why canines are important to protect the back teeth is when I read it in this great book by the late legend Misch, an implantologist in the US. I think that it was an implant textbook, contemporary of dental implants or something, many years back. And he explained canine guidance in 1 paragraph in the simplest way ever. And I want to share it with you. And it's something you can use to talk to patients about, but some patients will not get it anyway. But for you, if you understand it, then you will be very obsessed about canine guidance like me, and you'll protect all your fillings and all your crowns and all your orthodontic treatment as well. So first, there are groups of muscles, as we know, the masseters, the temporalis, and the pterygoids, the lateral and medial pterygoids. When we chew on the back teeth, when the back teeth are touching, most of those muscles are switched on. The masseters are contracting and switch on the temporalis and the pterygoids. When we move right and left, and only the canine touches and the back teeth are not touching, the temporalis and the masseters, which are very strong muscles, are switched off. They're not contracting. Only the pterygoids are contracting. But if you lose your canine guidance because maybe you overfilled a 1.4 or 1.5, or you made your crown inclined cusps on the 1.4 and 1.6 in a way that they're touching when the patient is moving, or you didn't finish your orthodontics properly, so when the patient is moving right and left, the back teeth start to touch. Once the back teeth start to touch, the masseters and temporalis will switch on again, and they're very strong muscles. And when they switch on, they crack a cusp, they can cause some sort of interference, some bone loss, recession. The weakest link will give in. If the weakest link is the TMJ, they will get clicking and pain on the TMJ. If the weakest link is the muscles, they will get muscle pain and headaches. If the weakest link is the teeth, they will get cracks, and then you have buccal cusp failing, or your implants will start getting loose, or the screw connecting the crown and the implants start getting loose. If the weakest link is the buccal bone and the gum, they will get recession. So whichever is the weakest link, it will start to fail. So again, if the canines only are touching, muscles will switch off, the strong one, the masseter and temporalis. If the patient is moving the jaw right and left and the back teeth start to hit, those muscles will switch on again and they will do some damage. So make sure you screen for canine guidance, especially patients with problems. If you're doing any restorative work or any fillings or any orthodontic work or implant work, get obsessed with canine guidance and understand the importance of canine guidance. If you find this information helpful, make sure you like and share it with your friends and colleagues. If you want to hear more about my videos, please subscribe to my channel and you'll be notified when more videos are released. Thank you so much for listening to me. It means a lot to me.